All right, so this event is called Which Public Health Degree is Right for Me or is for me? I just noticed that I left out the right in the title slide right here. Well, there's no such thing as right and wrong when it comes to public health graduate education. All of these options are really great. So today's session is a current student panel representing our three main MPH programs in the department. We have a lot of different options across the university, across the School of Public Health, but three MPH programs in particular we're going to be focusing on tonight. And those are each represented by one of our wonderful current student panelists. So I will sort of give a brief introduction of the programs, and then we'll have each of the students introduce themselves. I also would like to introduce my co-host tonight. Lauren, would you like to say hi?
Hi, everybody. Yeah, I'm Lauren Sikowski. I'm the marketing and student recruitment specialist for, as Wade said, our on-campus or our health services, MPH, MS, PhD, which we're not talking about tonight, and our COPHP programs. So, yeah.
Yeah, and I work specifically for the online MPH program, but I've been with the department for a while now, and I know a good idea of the differences between them. So let's first start out by listing the programs. So we have our sort of mainstay MPH program, which is the MPH in Health Services. And this program is our on-campus program, our most sort of traditional format, and it offers a couple different options in terms of concentrations. There's a generalist track and two concentration options, one in health systems and policy and one in social and behavioral sciences. We then have the COPHP program, or Community-Oriented Public Health Practice Program, which is a unique format program based all around what's known as problem-based learning. I'll let Jeff explain it more better, but it has a unique format and a unique cohort and is really geared to exactly what the title is, community-oriented practice. And finally, we have the online MPH program, which is the only online MPH program that we offer at the whole School of Public Health. But our program is a general MPH that has a focus in public health leadership. So they all are, of course, Master of Public Health programs. They all have sort of very different formats, but they are all CEPH accredited or CEF accredited, which is the accrediting body for public health programs. And they all share the same MPH core curriculum, which is the sort of foundation curriculum. So the curriculum for each of these programs is available online. I just wanted to give a sort of a brief introduction in case you haven't had any opportunity to learn about the programs at a high level. But today's session will really be learning about the differences through the experiences of our current student panelists. So now I want to turn the attention over to them. And if we can just go ahead and introduce ourselves, we can just go in the order listed here in the panel. So it is my pleasure to introduce one of my program's star students, Dolores Mack.
Oh, well, thank you, Wade. I appreciate that. And thank you also, Lauren, for co-facilitating or hosting this event. Hello, everyone. I am Dolores Mack. I am a registered nurse. So happy Nurses Week to all of the nurses who may be online. It's funny that today is actually exactly 7 years since I have graduated from nursing school. So that is so exciting. I am a public health nurse. I've been a public health nurse since February 24th of 2020. Like he said, I am in the online Masters of Public Health program. Forgive me if I forgot the third piece that you wanted to say in the introduction, but I really enjoyed the program. I think it definitely was the best fit for me. And I know we're going to go into that in more detail, but public health nursing in this MPH program, specifically online, was a great alignment for myself. Thank you.
Great, thank you so much. Yeah, we'll get into all the nitty gritty. So feel free to just introduce yourselves and share a little bit about it. I actually didn't ask, so you didn't forget. I didn't specify. But Jeff, go ahead and introduce yourself.
Hey everyone, my name is Jeff Parkerson, he, him pronouns. I am a second year in the Community-Oriented Public Health Practice Program. It is a mouthful, so we just call it COPHP. Yeah, I'm happy to be here. I will answer, I guess, all the questions that y'all have as we get deeper into it, but I just wanted to introduce myself and say hi.
Thank you. Amanda.
I totally feel Dolores on the on like questions on at this time of the day. But hi, I'm Amanda. I use she, her pronouns, and I am in my final year of the MPH in health policy and systems within health services. And I'm also a dual student with the public administration school. So it's nice to meet you all virtually.
Excellent. It is so nice to have all of you. All right, I am going to now remove the actual slide so that we can just sort of see our panelists here with the focus on our panelists. All right. Okay, so tonight's session, we'll cover everything from more personal details about your own experience, but really comparing, each panelist will have an opportunity to chime in about their own experience and why this program is right for them. So let's go ahead and get started with the most basic question. And it is also one of the more complicated questions, really, like how and why did you choose your program? There are so many, factors that lead into that. What did you study beforehand, or what sort of experiences led you to this field? How did you know that you wanted to go into public health? How did you know that this program would be a right fit? Lots of different ways you can answer this question, lots of different things you can share with us, but basically the how and why did you choose your program? And feel free to, for this session, for our panelists, speak whenever you'd like to. We don't have to go in the same order every time. So chime in, whatever.
Sure, I don't even mind going in the same order. That's a really good question. So just a quick background. I have 2 bachelor's of science degrees, one in nutrition and my second one is in nursing. And originally I was in med surg and definitely did not want to do that long term. So I transitioned from med surg and I got a role in the maternity support services / infant case management program with King County Public Health. And I was in that role for all of 3 weeks before the pandemic hit. And then it became a action call for all public health nurses to respond to the COVID relief. So I did isolation and quarantine work for over a year. And then I was asked to be the nurse supervisor and spearhead our mobile vaccine. So while I was at isolation and quarantine, I just really fell in love with public health nursing, emergency management, the response. So I actually had missed the original deadline for applying to the online program. And originally it was entitled Executive Leadership Track, focusing on getting us prepared for senior level management within public health. And I knew that is something that I always wanted to do in my career goals. I call my career goals, in the office, in the field, in the classroom. I would love to be in leadership positions. I enjoy field work, direct patient care, and I also believe that you reach back and you teach. So when I went back to UW's website and was reviewing the programs again, I noticed that they reopened applications for the executive leadership track. So I feel like it was meant to be. I really thought the program was best. It was 18 months, it's online. It just was I love the curriculum. And I don't want to take too much time. I love the curriculum. I felt like it really would prepare me for public health. So, because in nursing school, to be honest, everything is geared towards the hospital. The community health section is very limited. So I knew this would expand my horizon. And there isn't a master's of science in community health or population health, at least from what I've seen. So the program for me, it was perfect. It was online. It was 18 months. I'm scheduled to actually graduate next month. I'm so excited. And it just was a total good fit. Thank you. It really focus on social determinants of health, just so many aspects within public health, and even the exposure to finances, which I really liked in the curriculum, because in nursing, you don't focus on finances, but when you're in management, you really have to take those figures into consideration. So for me, it just really gave me a deeper focus into public health and how nursing really is a part of that, but also it's more than just nursing. Thank you.
I can go next. Okay, yeah, these are really hard questions. Okay, so so I am, I guess I'm what they call a non-traditional student. So I did not start in public health at all. I came from a sales and marketing and sort of corporate background. And it was a great job and the money was great, but you know what, after a while, you just kind of realize that it's really unfulfilling. So long story short, I ended up working in health and fitness, and I had played with the idea of going to a school to be a physical therapist, but my love has always been mental health and psychology. So long story short, I finished up my undergrad in biopsychology, and just from talking to people in undergrad, I learned that there's this really great intersection of mental health and public health, and heads up, it's very, very in need of help, because it's sort of like the redheaded stepchild of public health. People just kind of forget about mental health. So I decided to pursue public health. That's a long-winded way of saying I wasn't sure what I wanted to do in public health. I just knew that I wanted to help a bunch of people at one time, instead of like one-on-one, which there's nothing wrong with it, but I just really felt like I would enjoy the work of helping populations and communities. So how do I know the program was right for me? That's a really hard question. And I feel like it would take me a long time to really answer it. I will say this. I wanted a program that was going to not just give me the theories and didactic knowledge that would prepare me as a professional, but I needed a program that would give me like the application of like the theory, so like I can hit the ground running as a professional after I graduate. So and I can go into more of the minutia on the detail about what that was like for me, because I know I've been in your guys' shoes, and I know it's really overwhelming to like think about what program, cost, this and that. So I totally feel you. Feel free to ask any questions, but at the end of the day, I know I made the right program, and much like Dolores, I am 30 days away from graduating, so I am so ready for this. So I'll pass it off to Amanda.
Great, thanks. We will be in a time warp graduating, so I feel you all. But for me, so how I chose my program, going similar to the two other folks who just spoke, I wanted to do systems work on mental health and homelessness. And I had done my undergraduate in public health as well. And I just got to do a lot of experiences in the field with like immigrant populations, limited English proficient populations. And I just realized that it was a pathway that I wanted to learn more about. And I wanted to learn more about the graduate level of like policy change and how policy worked to do actionable tools there. And also the other reason is like, there's a lot of wonderful faculty at the School of Public Health in the HS Pop department. And that's one of the things I'm going to plug too, like reach out and try to schedule informational interviews if you can, because I was able to talk with a bunch of folks and they're so nice and they're real too. They're like, here's the pros and cons. And do you want to like, does this fit your profile? So it's really great if you have some mentorship there. So those are just some of the reasons and also to plug the capstone as well as the thesis opportunities, like either way you kind of get it, and the field practicum in the MPH, like I got to work in the field with a lot of organizations and really clarify my pathway too. Those are some of the reasons to pick the program.
Awesome. Thank you all. I'm going to follow up with a few more questions on this because I think this is one of the biggest things about how did you know? How did you arrive at this? And so Jeff, you sort of mentioned you knew what you wanted, but was there something in particular that really stood out about the COPHP that resonated with you personally, and you chose it over, say, the in-person the health services MPH or the online program?
Yeah, so I definitely looked at a couple of different schools and programs, and kind of really trying to think about. I wish I can say that there was like this one like aha moment that made me say, oh, this is it. It was a big component is the method of teaching in my program. So they do, there's almost no lectures. You'll have lectures in biostats, in quant, but pretty much the entire rest of the program is done PBL style, which stands for problem-based learning. So there's no textbooks. You won't have to spend a crap load of money on textbooks. Everything is case-based. So you are presented with cases, some of them real, like for example, what's happening right now with the Hanford nuclear site. Some of them are hypothetical cases, but the faculty will present cases to you, and you and a very small cohort of no more than like 27 people will work together to create interventions, community engagement activities. You're basically presented with a real life problem, and you're going to attempt to sort of solve it as a public health professional. And for me, I think part of it was coming out of undergrad, and I was just so sick of lectures. So I think a part of it for me was I really found this concept of doing learning by doing style of education really, really enticing. I sat in on a Zoom lecture because it was pandemic, right? So I couldn't sit in person, but I watched a class online, and it just really spoke to me. And again, I wanted to not just learn theory, but also learn how to apply that theory to like actually solve some public health problems. I hope that answers that question.
Sure. Yeah. I mean, it's different for everybody, of course, but I think it's we always get questions about the format, and it's not for everybody. The COPH program, the in-person health services program, or the online MPH, because they have such different formats, they really do have, they fit different learning styles. So what would you say is something that really helped you consider the program or learn, like through the experience of looking through programs? I know that Amanda, you mentioned informational interviews throughout the process, and you, Jeff, you mentioned you sat in on a class. Is there anything else you all did during your search for programs that really helped you learn or helped you make your decision? Dolores, I know you mentioned it was sort of a moment that you thought it was a sign that you could apply for this program, because one difference about the online MPH program is that we will often have rolling admissions. It changes each year, and we do have entry to the program in both the fall and the spring, whereas most of our on-campus programs or other programs only have entry to the program in the fall, and their deadlines are sometimes earlier. So sometimes the online MPH program might be more accessible for certain folks, especially if they're trying to start as soon as possible, and there happens to be availability after the deadline.
Sure, no, that's a good question. I think for me, since I knew that this program structure with it being online was perfect, because I was really in the thick of COVID. I really could not do a classroom setting. Obviously, we all could not do a classroom setting, but I have done online classes before for prereqs into nursing school. So I knew that I could definitely take on being an online learner. But I think one thing is crucial when you're inside of a program, because you're looking at pre-program, you're looking at, okay, this is what they offer, this is the structure, this is what I can see based off of the information online. When you're in the thick of it, you also too have to determine if that program is right for you. And I think for me was very a win-win, is that I like what I saw before I got into the program, and I really enjoyed it inside the program, you know, because there are some who did decide that it wasn't best for them. So we have, you know, they've gone into other either MPH tracks, or I know one went into public administration. So you do also have to determine once you're in if that is the best for you, but also not necessarily just in that moment, but longevity, you know, because every quarter is going to be different. And even though this particular quarter, the initial quarter might pose some challenges, can your schedule still conform with what the program is offering? And for the online program, our classes were every Thursday, 2 classes, sometimes 3, but it was always between 7 and 9. So I knew that was consistent. You know, I knew, like Jeff mentioned, maybe no textbooks, but we did have some textbooks, some we can buy, some were online, e-versions rather. A lot of professors use PDF articles. So you also too need to really see what they're offering in the syllabus, because it kind of will fit the pattern keep as you move on. But for me, for Dolores, it's just the complete structure. With the busyness of COVID, I was working 12-hour shifts plus multiple days online, designated time was good for me.
And I guess I can build off of that then, speaking a little bit towards like ways to learn more. I think you can also use LinkedIn, love free tools. Go to the SPH page and look up other students who have like MPH student or COPHP or online MPH, and you can connect. I feel like as a community, we're willing to talk. And I think we'll have some breakout speed dating later here. So we're down to give you the real. But I think that's a good measure to kind of understand what program fits best for you, as well as like who you might have an opportunity to work with. I personally found 2, if you go on the website, it lives somewhere on the SPH website, but previous like thesis titles or capstone titles or practicum titles, because then you're like, oh, get a feel for the organizations that students in the MPH are working with. Like, for example, my practicum, I got it because this professor had this connection. And so it got sent out to the listserv and then I jumped on it. So it's often about that public health network too. And that's one of the great ways to explore it through these publicly available like resources.
Yeah, jumping on that, and that's such a great point. Amanda, as you were saying that, I was having flashbacks about all the stuff I was doing when I was scoping at schools. So you guys, do not be shy. Go onto LinkedIn and just message people. I mean, obviously, don't be rude about it. But I would say things like, "Hey, I noticed that you graduated from so and so program. Would you, be willing to share your insights?" And no one ever said no. People really do want to share their experiences, right? So I must have had like dozens of informational interviews. I also noticed where they were working. So that was one of the other deciding factors for me. So like if you how LinkedIn will just like kind of suggest people, oh, this person's like in this network, if you like follow COPHP or something. So I just started looking at where they were working. A lot of people were working at Public Health Seattle-King County, which is the local health department here. A lot of people were working at Washington Department of Health. A lot of people were working at CDC. I'm like, okay, all right, that's kind of cool. The other thing, and this was a factor for me, which is I kind of get the sense that a lot of people after they graduate with their graduate degree will end up finding work around the area from where they graduated from. Like, I mean, I'm not, some people obviously might move away, but out of my cohort, most of them are staying here in the Seattle area or Washington State. So one of the other things I thought about was where I want to ultimately like maybe find a job after I graduate with my graduate degree. And I really didn't want to live in like the East Coast with snow. So that was the other reason why I might have chosen Seattle, because like I could actually see myself like enjoying Seattle and stuff like that. So that was another deciding factor. do not be afraid to reach out to people on LinkedIn. Oh, and reach out to the student representative at every program and ask them, can you hook me up with some people to talk to? Because any legitimate program will not be shy about connecting you with past and current students to talk to. So.
Yes, absolutely. We have student ambassadors on our web pages, or just you can email Lauren or myself, and we can put you in contact with some more folks. But thank you all so much for elaborating on that first very long question. Lauren, you want to ask the next one?
Yeah. So as far as, I mean, I guess going more into sort of preparing for your programs, you know, like what made you ideal candidates for your programs? You know, how did you distinguish yourselves? How can folks distinguish themselves that are interested in applying? You know, what other opportunities might there be for people to expand their resumes? I know that this is very loaded, so feel free to speak to whichever parts you can remember.
Lauren, do me a favor, repeat the first part of the question.
Yeah, so well, yeah, I mean, well, the thesis of the question is who's the ideal candidate? So, you know, what did you do to make yourself an ideal candidate, intentionally or otherwise? You know, like how did you frame yourself as the ideal candidate?
Sure.
Yeah.
Thank
And
you.
also as far as like extracurricular activities that, you know, folks can do to sort of build up their resumes.
I would say to that, as far as being an ideal candidate, you know, even if you're still in undergrad and now you're thinking about what graduate level degree you want to be in, you have a general idea of your career pathway you're wanting to go. So you do need to determine if what program is the best for your career pathway and how it will propel you to be successful in that career. Because, you know, you're not just paying for a degree and adding on loans or whatever you're doing to pay for it. You really want it to actually build you as a person that will be an asset to any company, organization that you're going to be a part of, right? So I look at it in my sense, I really could just start with BSN and be a nurse for the rest of my life. However, I knew that there were some shortfalls when it comes to public health for nursing. So if I want to have longevity in public health, I think I can still be on the nursing journey, and it's okay to take a little, you know, detour, go sightsee. And so I'm sightseeing in a sense in public health, going to go back to nursing as far as a doctorate. However, that is what the path that I've chosen is crucial for Dolores. And then also too, when you get into your cohort, I mean, just coming from just being in healthcare, a master's of public health is a very popular degree for medical doctors. And so I have several in my program. And so I also have those who work for the CDC in my program. I also have those who are deputy directors of their public health department. So when you're in your program, and I know we spoke to, and I think the LinkedIn option is awesome, trying to understand if that program is right for you. But when you get in there, the curriculum and the professors are not your only resources. Your classmates come with the wealth of knowledge. They also come with careers. They also come with experience. Like even with Jeff, you know, with your background in sales and, you know, I think you said marketing, if I'm not mistaken, but oh my gosh, our marketing class in the current one now that we're talking about liabilities and assets and all that great jazz, you would probably thrive in that area. So, you know, you have to really think about how your program can really truly expand your knowledge, and also to tap into your classmates, because you do become your own little family within that cohort. I think I'm answering that, but that's, yeah, thank you.
Yeah, I'll add on to that. Okay, so I was just looking at on the COPHP webpage because I forgot what the requirements are, right? Like, okay, like, you know, nice GPA, at least with my program, 2 years of work experience after your bachelor's recommended. I think all those things are sort of like normal prerequisites for most MPH programs, if I'm not mistaken. So I will say this. Like, if you ask me what I wish I had done, like if I knew what I knew now back then, I would highly encourage everyone to volunteer at a community level. I think one of the biggest, and you will learn about this in your MPH program, one of the biggest challenges in being a really effective public health professional is trying to implement population level interventions without getting to know the community first. It is a major problem, and they will teach you about it, but not knowing how to engage with a community and trying to do community level work will blow up in your face. So for example, I volunteered at San Francisco suicide prevention for a few years because, you know, mental health stuff, but my God, the knowledge, the information that I learned from lived experiences of people that are experiencing suicidality was probably one of the most incredible educational experiences for me. These aren't things that can necessarily be taught in a class because we're talking about lived experiences. So my point to all this is I highly encourage all of you, if you truly want to go into public health and be formidable public health change advocates, is to get your hands dirty and just listen to the stories of some of the people in the communities that you are thinking about serving. I will tell you that some of the MDs, okay, Dolores, I'll tell you, some of the MDs that I've met who pursue MPHs are, you can tell that they've only done one-on-one work. Let me just put it that way, okay? I would say that for population level work, you want to know how to engage with the community. And I can go into more examples if anyone wants to reach out privately, but I think for me, that's probably one of the most incredible learning experiences is to gain that before entering an MPH program.
Yeah, and to round it out the conversation, I think the ideal candidate has like a why. Like, why do you go into this program? And you should be able to communicate that in your application and when you just talk about it. Like the first questions they asked us as a panel is, why did you go into this? In the same way, like when you go into public health, go into your why and also go in with openness, like be hoping for almost like breaking whatever horizons and thoughts you have in your brain. And like that's graduate education should push you and push your boundaries and push like what you acknowledge as like true, almost in the sense of like, you just want to learn something. So go in with openness and go in with your why, and just, again, like utilize some of the skills you learned perhaps in undergrad to communicate that, whether it's through writing skills, speaking skills, and really just explore that, like spend some time, whether it's in conversation with others, conversation with loved ones, like volunteering, you know, deeply reflect on your why, and then match that to the graduate program you want to apply to. For example, if you want more in practice, or you want more research, or you want something that's flexible with a work option, there's many different opportunities to pursue your why. Just finding out what that pathway is.
I guess I just want to add one more thing to what Amanda just said. Those letter statements of purpose, right? All those letters that you have to write for grad school stuff. Oh my God. Your why. I think all of yours, you guys' individual lived experiences are going to be the foundation for your why. So I'll be very transparent. The reason why mental health and suicide prevention speaks very much to me is because it hits very close to my family. And a lot of my very immediate loved ones suffer from their own share of mental health challenges and substance misuse, you know, barriers. So for me, that gives me my why. And I've learned that your lived experiences are probably like the greatest asset that you can bring to this work, because everyone's experience is a little bit different. And even if two people have the same experience, they will interpret it differently. So definitely leverage your lived experiences. Even if you don't think like there's something that stands out, it will, because it drives the purpose of your why in those statements of purpose and letters and stuff like that. So.
Yeah, thank you so much for bringing that up. I think this is very important. We at the UW School of Public Health take a very holistic approach to admissions, and you know, the statements that we require. One is like, why are you pursuing the MPH? What are your goals and aspirations, and what qualifies you for this? But then the personal statement is equally as important as a chance for you to really connect to the values that we are aiming for in public health in terms of health equity and equity overall, diversity and inclusion. And so lived experiences is not uncommon. That is the reason why people pursue public health. Even if you don't think you have that sort of story, their recommendation, you know, get out there and have those experiences in the communities or volunteering. Learn as much as you can to build up your awareness. And I think that this is really key, because a candidate might look really great on paper or have these sorts of qualifications that we're looking for, but if they can't articulate why they want to go into this field and can't convince the admissions committee that they're the right kind of people for this type of job, then they might not be the right fit after all. So I think these are all really great points that I just kind of wanted to add, that from even from the admission standpoint, like this is all exactly what we're looking for. So thank you for all chiming in on that.
Real quick, since you just touched on like the application requirements a bit, like I know we're talking about like quote unquote the ideal candidate, but anyone can be the ideal candidate. So if you're sitting out there thinking, oh shoot, like I'm not this and this and this, like imposter syndrome is real, especially in academic world. Don't let that get you down. You have, like Jeff just said, you have lived experience. You are qualified. Again, just emphasize and like use of resources like writing centers or references and friends, and do multiple copies, throw it in the garbage, write it again, like do what you need with your application to shine out your why, because you are all qualified. Like everyone is qualified for this program based off of like your various lived experiences. That's what public health is about. It's about being from the community and going in to make systems change.
I will also touch on, just because I know for the online MPH program, it is an explicit requirement that we do require at least 2 years of professional experience. And Dolores can attest to that many of the students in the program have well beyond 2 years of experience. Some have been out of school for 10 years or more. So for our program, that is important, because we do focus on things like leadership and management. But across all programs, whether it's not, you have to have at least 2 years of experience, the more real world experience, just like they've been saying, is going to prepare you better for the program. The more experience, even if it's not specific to public health, professional experience, even if it's in the service industry, building up those soft and hard skills that you can get more out of your graduate education to then apply to your future career. It's all part of your development. And so, sometimes you might not be able to get public health experience right out the bat before you get your MPH, especially since it is becoming a more popular degree for this field. That's where that volunteer comes in really key. You may have non-public health related professional experience, but you have on the ground dirt, as Jeff works, as Jeff said, some sort of like dirty work. Get your hands dirty in the field, because especially in our department, I think a lot of us can look at public health as sort of the marriage between health sciences and social work. And so I always like to kind of think like it, because we see people from both sides coming into this field, whether they are coming from medicine or science, or if they're coming from humanities or social sciences or elsewhere, like marketing or marketing and sales. Shall we move on to the next question? Okay, so these, we've kind of talked about what kinds of things you can do to strengthen your application. We also kind of touched on, what advice would you give? I think Jeff, you said, what would I do if I knew beforehand? Is there anything else that you all could, in hindsight, of course, hindsight's always 2022, would you suggest someone besides what we've just talked about, getting volunteer experience? Is there anything else that you would do before going to graduate school, or any specific advice for your own program?
I would say two things. One general, and then later my program specific. I've had the opportunity to sit in on application reviews or be like that student contributor to reviewing applications, both on the collegiate level and then also with another organization for scholarships. And one thing between the two that I have noticed is your strength and or areas of opportunity for improvement in your writing is definitely going to show when a panel is reviewing your application. So yes, the personal statement, yes, the statement of purpose, or any other statements that you have to write, even down to if you have to submit a resume. How well and how clearly you communicate is key. So if by chance writing is not your strong point, definitely go ahead and start reviewing resources to help you with formatting, to help you with grammar, to help you with any and everything, because once you are at a graduate level, it is expected that you have a certain level of writing skills. And everyone's on a learning curve. I totally get that, but just know that if it's a competitive program to get into, whatever way that you can make yourself, because you are only competing with yourself. That's how I look at it. However, you can truly make it clear that you are the applicant, and by way through your writing, please do whatever you can to improve that. If it's already superb, clap. Clap, clap, clap to you. That is wonderful. But typically with writing, there's always areas of improvement. English has always been my favorite subject, and I've done well on essays, but I decided to do a thesis for my program. And when I tell you my rough draft came back where it was not correctly organized, like, okay, you have a you don't know what you don't know. And I never wrote a thesis paper before, but also too, even following guidelines, you might not, you're just gonna, I didn't hit the mark, and that's okay. Like, I love to learn. So in order to learn, you have to not do something correctly so you can learn how to better yourself. But there are so many examples of like theses and other papers or anything on how you can format it. And so I would say, just from my experiences being on the panels or boards, reviewing applications, your writing strength does matter. Just being frank. I would say for degree specific, program specific, since mine is online, definitely understand that there's going to be a lot of self-teaching, even though there's a great amount of group discussions and group work. There are things where you have to do your readings, and you have to make sure that you understand it, because if you don't really understand the material, it's going to show forth in your assignments, your writing, your contributions to the group. So just be sure if you're choosing an online program that you do understand that there's going to be some self-teaching.
Wade, could you refresh my memory on what the question prompt is? My memory is just terrible in this very last quarter of school. It's just like, I can barely remember what day it is. So.
Well, we're still kind of continuing the theme of, how could you better prepare yourself for graduate school? What are things you might have wished you had before going into your program? Or do you have any advice for people applying to your specific program?
Yes. So for my program, Okay, so I mean, I can only speak as someone going through my program. Writing is definitely there. I'll be honest. I don't think that if I don't think that they would. I think you want to make sure that your writing skills are top notch. It's super important to be a very clear and effective communicator in public health. Time management. I can't speak to everyone else's program, so my program is fairly intense. I highly encourage everyone to learn time management skills. For me, chunking, I don't know if you all know what chunking is, but chunking your time, also known as the Pomodoro technique, is something that really helped me. It's a true skill because I've seen people in my program not be able to manage their time at all. Time management, I highly encourage everyone to get familiar with citation managers like Zotero or Mendeley. It is like necessary just to get through the sheer amount of writing that you'll have to do. At least within my program heavily emphasizes racism as a public health problem. It is a huge component of the entire program. And some people, it was very clear, some people never took the time to just sit and think about systemic racism and the multiple effects it has on vulnerable populations. So at least within my program. So like, I'll give you an example. The summer before I started my program, they sent out this message saying, hey, it might be really helpful for the entire cohort to read How to Be an Anti-Racist by Ibrahim Kandi. So like little things like that. Some people didn't read it, obviously, but at least within my program, making space for yourself to really sit with racism and how prevalent it is, especially right now, and the effect it has on health and in populations is probably will be a huge benefit if you were to enter COPHP. And I'm sure there's other things that I can't remember right now, but they'll come to me.
Yeah, and kind of to complement what folks have been saying too, like part of time management in graduate school is like self-care. So being realistic with yourself and what obligations you have and how your timing and availability will change based off the program you pick. Understanding like we all gotta eat, so we gotta have opportunities either that have jobs or other kinds of funding. So having a realistic conversation with yourself about that, about how you have good boundaries and how you take care of your own mental and emotional health, because I know graduate school's tough too with some of the hours that you're pulling on top of trying to like finance and everything. So yes, don't be afraid to say no. What Jeff just said, yeah, that's one of the things, like let the FOMO go and don't be afraid to say no. Those are definitely things that go towards having a healthy mind. And first off, you're like a human being rather than a human doing. So remember to place your value there. Like you are a grad student still, or whatever you're doing, just make sure you take care of yourself, because you're not gonna be able to do any of the other great things if you're not good inside.
Yeah, and you're kind of introducing the next question sort of from the back end. You're talking about boundaries and time management and maybe doing some of that internal work to literally emotionally prepare for the workload. Can you speak about the workload itself? Like literally, what do your weeks look like in your programs?
Sure. I think for what the weeks look like as far as workload will always change by quarter. My program started off with, I think it was 2 classes for my first 2 quarters. And then once we hit 3 classes, you feel it, especially if you are a full-time employee, and then also you're going to school full-time. So everyone's experience is going to be different. Everyone's experience is going to be relative to their situation. for Dolores. For 2 classes, it was manageable for a certain aspect in a sense. But when we really got into a lot of heaviness within isolation and quarantine working in COVID, it made it even more stressful. So, you know, pandemics aren't permanent, but in that situation, that was my situation between work and school. And sometimes work's scheduled for 12-hour shifts turn into 16. So, and you still have assignments, you still have group projects, you still want to hold your weight. So time management, of course, is definitely everything that, you know, Jeff and Amanda have said is definitely very important, but also know that it's going to fluctuate per quarter. And I did find that the quarter that we had 3 classes, for myself in particular, well, actually all my classmates, it was the most challenging because all 3 classes had group work, and then it was not at the best time for anyone in the pandemic. And it's like, yes, it's online, so that helps with your schedule, but of course we're all online, but every quarter is going to be different. How you balance your workload as far as being an employee, or if you're a part-time employee, or if you're full-time student, part-time student, every aspect of your life has a purpose. You know, you're not fully your career, you're not fully a student, you're also someone's child, you're also someone's parent, you're also someone's spouse. So you really have to have a holistic view of your schedule to the best that you really truly can. You know, it's always like, you know, you have 24 hours in a day, but you're not utilizing all of those hours, and prayerfully you're sleeping at least 7 to 9 of them. You know, don't tell the nurse you're not getting good sleep, because that is really crucial. So it's a challenge. I can't even get around that, you know, but of course there's the goal, you're persevering, you're pushing through. But that's a part of your journey. So I will say that in being encouraged, like, even though things might not necessarily feel like you have the best time management, if you are successfully getting through your program, if you are successfully getting through your job and being able to spend time with family and sneak in some self-care at that, you have to applaud your victories. You know, it might not look the way you have envisioned it, but if you are every day that you're accomplishing something for your goal, short-term, long-term, whatever the case may be, I would say be encouraged by that. But do know it's, you know, you're signing up for graduate school and you have to realize what you're also signing up for. And there's always a means to an end, and there's always the joy and a blessing coming out of that. So just persevere, but just know you'll have a challenge.
Dolores, I definitely applaud you. I cannot believe that you were working full time and doing grad school. I actually don't think I could do it. I don't think I have the capacity to do it. My program, I know some people were working part-time. I don't think anyone was working full-time. The first year was definitely the hardest. So I'll tell you, I vividly remember the very, very first quarter. They shove you into the deep end. You start off in population health and community engagement or development, and you have 2 5-page research papers every single week. And it was crazy intense. This is why the citation manager really helps you. The interesting thing about my program, because we kind of teach each other, because the instructor isn't really instructing, they're just sort of facilitating the case. So we basically, if we don't do our paper, then we would like the rest of the cohort would not be learning something. So the guilt and fear of like letting down your cohort actually is a really great motivator for getting your work done. But 2 5-page research papers every single week, and then you dive right into working with a community partner. So my first quarter, we worked with a rural health department here in Eastern Washington doing a community needs assessment. So that was really cool. That's a really good example of us applying what we were learning. So like I did something I had never done before, which was community asset mapping of strengths and barriers. And like I basically had to learn as I did it, and it was a really cool experience. Then you dive right into biostats, two five-page papers every single week, and you start your practicum. So that's when it gets even crazier. Spring quarter, I forgot what it was. You continue to have those 5-page research papers. Second year, it slows down just a little bit, only in the sense that like you might have like two 5-page research papers, or maybe like a 3-page research paper, but you're also working on your capstone project, which is a year-long project. This quarter that I'm in right now, my last quarter, it's a little bit easier, but they've specifically designed it that way so that we can finish our capstone project, but also give us the ability to like work on our resumes and do necessary networking, because we are on the verge of looking for jobs, right? Tons of group projects. Last quarter in winter, we did a quarter-long project with a nonprofit organization here in Seattle. We did a complete program evaluation. Yeah, that's sort of like a really quick synopsis of what my program is like.
Yeah, and to speak to the in-person HS Pop MPH, so there's different tracks. There's the generalists, the social and behavioral sciences, and then I'm in the health policy and systems track. So I have slightly different electives, but across all MPHs, like including our department, as well as like EPI, Biostat, Global Health, all the other departments, there's a common core. And what's really cool about that is you get to take classes and be in group projects with like epidemiologists and biostatisticians and environmental health folks and global health folks. So it's a really neat experience where they completely revamped it, I believe 2 years ago, the system. So you'll take like 2 group classes a quarter, which they include EPI. There's essentially one from each department, one class that focuses on the work of each department, which is pretty cool. And then at least for the health policy folks, you'll take departmental classes with the wonderful faculty who are very funny. And you'll take a range of like research, health economics, and like actually policy consulting with different firms. And then for social behavioral self, I think they do more like program evaluation, qualitative methods, health promotion, and then generalists, you're invited to take a range of what speaks to you. And I think second year, we also similarly focus mostly on thesis credits, as well as any electives that you want to take that again speak to you across the school or across the university, honestly, that are interesting and can grow that skill set that you like. At least I know, like, yeah, you can get certificates and different things and mosh posh a bit, but second year gives you a lot of freedom to choose.
Wade and Lauren, if it's okay, if I can piggyback on something because it stood out to me, and thank you, Amanda. In your programs for your practicum, just for hindsight, I found that there is a lot of challenge with getting practicums in timely manners, because even though your program coordinator may be sending out information in regards to your practicum, opportunities, excuse me, you're not the only student applying for those. And even though the opportunities are really awesome, if there is an organization that you have in mind now that you would like to utilize, keep that in mind. Find out early if they already have like a contract agreement with University of Washington. And if they don't, look into those requirements on how to obtain that information and start a contract, because there are so many great organizations that can totally use your mind, use your skills, use your thoughts to work with them in the practicum capacity, but they just don't have the contract set up yet. And it's better to be proactive than reactive when it's trying to work on this practicum. So I would piggyback on Amanda and say that with the practicum, it's okay to go ahead and think about it early. Even if you don't understand everything about it, just know that there is some work done that you can have with the organization to utilize everything that you're learning.
I will piggyback off of that, which is, that's such a good point. And so I don't know, I can only speak to my program, but at least within COPHP, they have a running list of practicum sites. You know, everyone does get their, everyone does get a practicum for capstone. So I pursued my own, I created my own capstone project. And Dolores makes a really good point. I would say another thing that will make you stand out as a student is being a, I hate saying go-getter, but being, not being afraid to put yourself out there to kind of, to instigate some change. So I didn't like any of the capstones on the capstone list. They were all so boring, but no, none of them were mental health oriented, I'll be honest. So I sought out a mental health nonprofit here in Seattle. I was like, hey, can we brainstorm a capstone project? So I found one, and I'm creating this predictive risk index for neurodevelopmentally challenged youth who use their programs. So like, I just kind of created my own capstone. So that's another thing that you can do. If something doesn't exist that you're very passionate about, don't be afraid to kind of like just try and create it. Like I legit called the DOH, Department of Health, and said, hey, can you supervise a capstone site? And they couldn't because they were so overwhelmed with COVID. But I'm so glad I did create my own. So to Dolores's point, don't be afraid to think about what you want to do right now, and you can just have fun with it. Part of grad school is you can kind of mess up in grad school. It's grad school, right? So don't be afraid to like try something that you might not be able, like you're too kind of scared to try, because it's okay to mess up in grad school. You're in grad school. I mean, you're paying for it. Come on. So it's okay to mess up in grad school. Okay.
I think, you know, so for those in the audience who might not be super familiar with the practicum, you know, it does sort of vary. Well, I would say it doesn't vary that much between program. It really just varies between people, between individual students. Each program will have a specific advisor, staff person to help students, you know, find their practicum, sort of figure it out. Some students, you know, they, like Dolores was saying, and Jeff, you know, if they want to spearhead their own idea, if they already have something in their mind that they want to work with, if they already have an agency in mind, that's totally fine. The UW School of Public Health also has a wealth of agencies that they work with, and a lot of history having practicum agreements or having students work there in the past. But for it is, I haven't done it, so I'm not the best person to explain it, but it's like a project-based internship. Would you say that's a good way to describe it?
Project-based internship, making sure that you are meeting the learning criteria for public health. So that way you're truly making that connection. So yeah, I would say that is definitely a good way to summarize it.
Yeah, so like what, well, I guess we kind of maybe talked about this a little bit, but the online MPH program does have a fixed curriculum or a set curriculum where we don't offer concentrations such as the Amanda's program, where you can have a concentration or a generalist and choose electives. It's changed a little bit over the years, but the practicum is really that open opportunity and is flexible for students to really sort of seek out their own, you know, work in for an agency that interests them, or find a specific sort of niche kind of that appeals to them. And just like Jeff mentioned, you know, knowing that you want to do something, and not to put pressure, but the practicum is often one of the, you know, culminating experiences that may lead to, you know, great connections, working with those agencies, potentially, you know, securing employment after your program, you know, making those connections. So it is, like they said, never too early to start thinking about it, as it will be a key part of your program. All right, just to recap, so the online MPH program, because of its format, does allow students to work full time, since we don't have daytime classes. And the vast majority of our students do work full time. For the other programs, I don't know, Jeff, you kind of implied that you don't work during your program. Can you speak to the other students in your cohort that may work part-time? And Amanda, how do you fill out your schedule?
Yeah, so, I mean, I moved here from San Francisco, so I came here with no job. And once I realized the pace of the program, I was like, I don't think I'm going to work while I'm in this program. Several of my cohort members, most of them did not work. One of them might have been working, but most of them weren't working. Once they found their groove, many of them found RA ships and TA ships. One or two were, doing some side hustles on the side. But I don't think anyone was working full time. Also, I think it would just be difficult with the scheduling because your schedule changes from first year to second year. It can also change from quarter to quarter depending on what section you're in. So it actually just might be challenging schedule wise if you had like a full-time work schedule, because it's difficult for them to shift all that stuff, right? So yeah, the most people would work maybe 20 hours a week. RA ships and TA ships will pay for your tuition for that quarter. So that's also a really great option. They can be competitive from what I understand, but I mean, you never know until you try.
Yeah, similar to Jeff. Personally, I did a TA for the first year and then an RA ship the second year. And like Jeff said, they do include a tuition waiver if you worked 50%, which is 20 hours a week, and really good health insurance. But it's important. But they are competitive. There's opportunities. Like one of my friends applied for one in biology. So you can apply across the university. It's very random. There is the graduate GFIS. I don't know what it stands for, but it's a funding source, as well as SPH jobs for funding opportunities. I know, especially, it is something to think about in terms of balancing. There were some folks who are working close to full time. Oh, perfect. We just linked it. But that's something to explore and keep in mind. I know SPH as a whole is striving to create more student funding opportunities as part of its like strategic plan moving forward. But so perhaps by the time you all matriculate, there will be more positions opening. But for now, there's a mix of positions and folks doing different things that they need to do to get their lives funded. So do what you need to do, kind of.
Yeah, and just to sort of close the loop here, like I said, the online MPH program with its format, allows a lot of people to work full time and they choose to do so. But the online MPH program by default is also a full-time rigorous program. So it's, even people in the online program decide, if they have the flexibility to lower their hours, you definitely can't. It's like Dolores mentioned, like you can't work overtime and do 3 classes in a quarter. It's just like a lot. So keeping those expectations in check, knowing that it really is difficult to schedule in working full-time on an on-campus program like the Health Services MPH or the COPHP program because of the daytime classes and the on-campus commitments, whereas definitely more feasible with the online MPH, but still something that could be tricky to balance. All right, moving on. Let's see, do you want to ask the next question, Lauren?
Yes. Yeah. So, I mean, we've kind of touched on it a bit, but so what resources have you taken advantage of? What university resources have you taken advantage of during the program? So speaking about the types of support that there are, so that could be mentoring, career assistance. We spoke about financial a little bit, but if you want to expand on that. So resources and support.
Sure, I'll be really quick here. For this particular subject that really stood out to me is, of course, they're going to teach you about the UW library system, the writing center. There's a plethora of resources that the campus offers. But one thing that Christina, who is our former coordinator for the program, emphasized to us when we started is you have tutoring opportunities. Like you can sign up to actually get a tutor, one-to-one, someone who that's their subject matter expertise. They're typically either they have a master's in the field, or they actually are a doctoral student. Yeah, that's another way too, that you can also be a paid tutor. So I think that for me was like the greatest resource that UW offered that I truly utilized, because biostats was definitely not my cup of tea. In my online program, we had biostats 1 and 2, and they did that to me. And I needed a tutor for both. I was very humble about it, and they sometimes different people explain things differently. And it's not to say that I didn't understand it from my professor, but the tutor made it so easy for me to understand. And they also too have that time, because they're paid to, one-on-one. So it's fun. And I also had a tutor for epidemiology. So it really is a tool. It's a free tool, or is included in tuition some kind of way, because I didn't pay anything additional out of pocket for it. But please utilize that. It's really cool. They want to help. They signed up for it. And you also get to choose your tutor, because there's like a spreadsheet, an Excel spreadsheet of like how you are the best, like how you match with the person, or it's like either is availability or something of that nature. All of my tutors are actually on the East Coast. At the time I was living back home in Washington. Now that I'm in Texas though, but it's still like you work with their schedule. I felt bad for a couple of them, because it's like 10 o'clock at night for them is the best time for me at 7 o'clock in the evening. But they are really flexible, and they have a true desire to help you. So if anything, definitely utilize that service.
Dolores, I think everyone in my cohort feels you on biostats. And obviously I'm joking. Some people do like it. Okay, so I didn't use the resources that I use at UW. Definitely statistics tutoring. There's like a department, I forget what it's called, and they offer free statistics tutoring. I think it's actually part of the program development for statistics students. So that's really helpful. There's also a writing center, which definitely helped a lot of my fellow cohort members really elevate their writing. The librarian is such an underutilized tool. So I don't know if any of you all have done like a systematic review or a meta-analysis or even just a literature review, but for a lot of people in my cohort, it was sort of a new concept for them. So sitting down with the actual librarian, like they will sit you down and actually go through how to do like formative research. And it's a thing, it's like a skill, right? So that's a really great resource for you to use. I am very much about the intersection of physical health and mental health. So use the on-campus gym, you pay for it, so use it. Get some frustration out by getting your physical activity going. I have a fantastic therapist, but for those that don't have access to it, there are mental health resources on campus, and it's so important in grad school to take care of your mental health, like preemptively, like I'm serious, because once you start feeling like you have mental health stuff going on, then it's there. Like you want to preemptively prevent that stuff from even happening. I will tell you, for me, the greatest resource were my fellow cohort members. While I don't get to know everyone, I have made a very small handful of very, very tight-knit friends. I'm very proud to and happy that I can call them friends now. And they will be your rock during a very stressful time. But not just that, but you can also commiserate. There's something to be said about being able to talk about your collective trauma of grad school as you go through it together. So I think the students that struggle the most are the ones that don't try to engage with their cohort members. They are going to be your cheerleading squad in grad school, and a really important resource in your network. So definitely utilize your fellow cohort members.
Yeah, and just to add, I think cohort and faculty, like I think a lot of, we spend a lot of time together. Unfortunately, some on Zoom, but I had existential crises to some of my mentors about post-grad things, and they'll listen to you because they have been there too. And so just really wonderful faculty, as well as at the school level, there's great resources like affinity groups that are hosted, that are facilitated, as well as there's like a bias concerns line that was started if you ever feel like you have experiences in the classroom or just inside the community that just were not great. And the school will take action on those items. And those are just great resources within SPH that are available also within, at least for the MPH in-person people, we have Emily, who's our wonderful, lovely advisor. So I just want to plug her, who's also sat through my existential crises. But on top of her, there's also within HS Pop a really great network of research centers, the Health Promotion Research Center, the new Arch Center. And these are all, the professors are nested in those, as well as doing their own research projects there. So you can get a practicum or thesis or different advice out of those centers, as well as RA-ships. So there's lots of great branches, I'd say, of the department that you can utilize depending on what you want to do, whether it's more research focused or more practice focused. So different kinds of like educational resources to engage with.
Excellent. So this may, not to put pressure on you all since you are about to graduate, but reflecting on your experience thus far, how has your sort of career aspirations changed throughout your program? Do you know where you're going? Do you know what you'd ideally like to do? How has this program prepared you for the next step in your career? If you know, hopefully you'd have a better idea, but.
Yeah, no, that's a really good question. One thing I actually really liked about our social determinants of health class is one of our assignments was to write a letter to yourself. And you had to talk about what you were going through in the moment and what you hope to achieve from the program. And Dr. Stephen mailed it to us. You had to include pre-addressed envelope. And so he mailed it maybe the next quarter. And when I received my letter, I giggled because nothing changed. Nothing changed from my personal statement, my statement of purpose, to that letter, to how I feel now. It is still in the office, in the field, in the classroom. I want to be a director of nursing within public health, and I'm working towards that. Like, I love being in the field and being able to still be direct patient care. And then also the part I haven't gotten to is in the classroom, because I do need at least a minimum of a graduate degree to be able to teach. But for me, I think, my program was only 18 months, but it really is reassuring that it was a perfect fit, man. It just really was. And that's for me, it made me really happy, because if I could do it all over again, I would never go to my nursing program. Like, I made it through it. So for me to be able to get through those 4 years of which I felt like was hell, I'm just sorry, I have to say. I've had lots of nurse practitioner friends that told me that I think you have PTSD from nursing school. I think every nurse has PTSD from nursing school. So the fact that I found and have so much joy from choosing this program, so much joy and connection with my cohort, like, we are forever on Slack. I have to mute it because we are conversing so much. Like, we keep each other encouraged, keep each other abreast. Like, it just was really a perfect fit. And I think hindsight, I really wouldn't even change anything. And I actually really appreciate, I think all professors should incorporate what Dr. Stevens did with that letter, because you'll be surprised of how I felt, what I knew then versus how I feel and what I know now. And it also, for me, is just encouraging to stay the course, You made a great decision. Was it bumpy? Was it hard? Yes. Did the pandemic add to probably most of it? Absolutely. Because the program is what the program is, but add on a pandemic and everything else that goes with that, it was rough. But all in all, like come June, come graduation, like I think my whole cohort that are still graduating in spring, it's like you made it. You made it. It was the right decision. I can totally see where it's going to take me in my career. I'm still in my career. I have no desires to change, but I also see where the degree is going to propel me to greater heights. So I'm well pleased.
Dolores, speak your truth. Don't be ashamed if nursing school is like, ugh.
It was. Thank you.
Yes, I feel that. Yes. You know what's really great about grad school is how you change. So really quickly, you know, like I was talking about your lived experience. So I identify as gay, and if you can't tell, I'm Asian. So when I first entered this program, I was like, I am so going to focus on LGBTQ plus and Asian populations, because those are the communities that I identify with. And while I still, you know, want to help them, you know, my practicum was working with kids, and I'd never worked with kids before. And I realized something, a truly upstream, if you don't know that term upstream in public health, it means doing the most preventive intervention versus downstream, which is like what doctors do. You know, truly the most upstream preventive approach for mental health would be trying to mitigate trauma during the most developmental years for youth. So now I'm really heavily thinking about focusing on youth populations, because there's just something so beautiful about seeing trauma reduction in these youth populations. Speaking about the job and career stuff, one of the other great things, at least about my program, is the instructors, they're not necessarily PhD instructors. They are what they call clinical professors. So like, for example, my professors are people that work in the health department or in the Department of Health. One is a current legislator for one of the districts in Washington State. I forgot which one. One works for the CDC. So my point to that is career-wise, I've noticed that when I say, I'll give you an example. So I reached out to someone at the DOH and I was like, hey, you know, my name is Jeff Parkerson. I'm from a graduating student of CEO PHP. And they wrote back, hey, I graduated from your program in 2012. Let's totally chat. So there's this really, really tight connection, at least I think it's all it's within public health, but at least within my program, there's this very, very tight network of people that really want to uplift you. And the instructors are so well placed in positions of public health throughout Seattle and Washington that it really makes the fear of finding a job and your potential career stuff a little bit less. And one other thing that has changed during my time in this program is, you know, I never thought of myself as a leader. I definitely found my leadership qualities in my program. And there's definitely something to be said about me thinking about going into nonprofit directorship roles, something I never, ever, ever thought about. So these are just some of the examples, and at least in the way I changed my perspective in my program. Yeah.
Yeah, so career job search. There's great resources like the advisors, again, will meet with you, as well as the Career Development Center and career development resources. I'm personally like interviewing, and I actually am trying to work at some of the organizations that I got to consult with, like the Healthcare Authority in Molly's class in the fall that I took. So it was a really cool connection that they started sending out jobs, as well as positions. Like, I know a lot of folks are, at least in the policy track, want to work with like community health plan or Healthier Here, some of the managed care organizations that do a lot of insurance or just health policy in our state. quick plug for COPHP too. So one of my really good friends, Mariah, in your cohort, I love. I actually got connected with her. My faculty advisor, my first year, connected me with his reading buddy, who was like her boss. I don't know, a lot of public health connections. And we actually got to start like, don't know if we're quite a nonprofit yet, but an organization together. And so there's just opportunities across the MPH to network, and UW has a lot of different funding opportunities and just that changed a lot from when I was going in, because I was like very research focused. And then I started doing like practicum, talking with all these people and doing all these experiences. So you can still do, and I'm still doing a thesis, a research-based thesis too, because I still really enjoy research too. So you can really go a lot of different pathways. And then when it prepares you to go down careers that can integrate all of them. For example, some of the positions I'm interviewing for take in a research lens, but also a program and policy management lens. So it's really a mix of everything and all the skills you learn across the Common Core, as well as with the specialized courses that you take in the program.
Awesome. Well, I wish you all luck, of course. But this has been really great. Thank you all so much for answering our questions. I would love to now open up the floor, if you will, for some questions from the audience. If any of you out there have some questions that we didn't really touch on in terms of the differences between the programs, or more detail about any one of them that our panelists could help share more about their experiences, please don't be shy. You can either put it in the chat, or you're welcome to come off mute or video, however.
I have a question about, I don't know if you can answer these, about the certificate programs. I am employed full-time at the U right now, and have a particular heart and interested for the community-oriented program, but can't do that at this time. So I'm trying to evaluate if any of the certificate programs might be sort of good entree to the curriculum. I work in early learning, so also see that as a public health pathway. So I'm also just trying to figure out if any of the certificates would help kind of set a foundation for entering the workforce.
Hey, Krista, thanks for the question. I guess I'll go just because you had mentioned you have an interest in sort of working really at the community level. If I remember correctly, there are a few people on my program pursuing a certificate. One is in child and maternal health. Another one might be social determinants of health. I don't remember. Here's my hot take on certificates. Aside from a job that says you need the certificate, I personally think that you can get whatever you need from taking the right courses. You don't necessarily need to like sign up for that certificate path specifically. Someone can take a bunch of courses that are focused on community-oriented stuff and not necessarily get the certificate that says you did it, right? So that's sort of my hot take on it. And that's from hearing from my cohort member who's doing that maternal and child health. And, they're like, oh, well, I could have just taken these, classes on the side or as an elective without actually having to do some of the required writing that they require to just to check the box to get the certificate. I'm not sure if that's helpful or not.
That's helpful as a UW employee to think about, because you can take courses as a non-matriculated student. So yeah, that's helpful. Thank you.
Yeah, and to jump in really quick too. So one of my friends in my other program, she works as a UW employee as well and has for a number of years, and is using the graduate degree as a career change option. And I know that there's some kind of, if you connect with maybe the advisors, if you're really interested in this program to matriculate down the line, you could perhaps take courses that could contribute towards that degree while you are an employee and take advantage of the like economic benefit that you get as a current employee. So that might be great to connect to, like Wade and Lauren could probably connect you with folks who you could chat with to help plan that out a little bit. That's like longer term.
Yeah, there are a couple different ways you could approach this. So I don't know too much about the certificate offerings. I do know that I have spoken to students who have done, I don't know, Dolores, if you've had any experience or if you know of others in your cohort. I know that there are certain other certificates available for current students that are not, additional, they're not separate like enrollments. They're not separate programs, where we did have a certificate program and our program in public health practice, but it's been discontinued and I don't know the details of it being offered again. However, to Amanda's point, it is possible to, enroll as a graduate non-matriculated student and take, a certain number of courses that could then, if you do decide to pursue the full degree program, can contribute to that. I always say to other folks out there, in case you're hearing this, I don't recommend, it could work for you in your current situation, but I don't recommend doing the GNM process if you know that you're going to do the full degree program, because you will just have to like apply again. You have to apply to be accepted as a GNM student, and then you have to, and that doesn't guarantee acceptance to the program. But we do offer, we get some students that take like just a few courses as part of the online MPH program, just because they're looking for the actual course experience, which is like what Jeff was saying, it's not always the certificate, it's what you learn in the courses that can help. So there are a couple different avenues you can approach it, and I do encourage you to, contact us directly, and we can talk more and see what's available. And thanks for your question. Any other questions?
Hi, I guess I can go. I'm Amiria. I'm a third-year undergraduate at the UW, and I just had a question regarding experience. So what do you guys think is the best route in terms of gaining that experience? Because I know you guys touched on like how important it is. So like, for example, does that look like taking a gap year to get like health related experience, or like doing volunteer work while I'm still in my undergrad? Like, what do you guys think?
I can speak to this because I went to my undergrad at UW as well. One of the ways you can utilize is look for service learning. And I'm not, what, are you in public health right now, or are you in a different department?
Yeah, I'm a public health major.
Oh, okay, great. So there's a lot of other senior capstone, which will be really helpful as an experience. You can also look through the CELE Center, so CELE. They have a bunch of different experiential opportunities posted. Service learning is great because then you can fill your elective requirements for your major, as well as get to work directly in the field and like work and be part of the community. There's also different community health boards depending on the area of focus you want to integrate, who are always looking for volunteers. So look for the opportunities for like those kind of internships as well, and SPH jobs and opportunities, which are unfortunately a lot unfunded, which is a different argument, but just utilize that SPH jobs page.
Okay, thank you.
If I can,
Go ahead, Dolores.
Just something that came to mind when I was a nurse supervisor. One thing I would encourage our team to do is job shadow. So if you're not scheduled to work, or you get off early, or whatever the case may be, because I did supervise some administrative staff who were interested in becoming clinical. And if you have the opportunity, I mean, I know it's not paid, but you know, you don't know what you don't know. And I think exposure is everything. So if there's something that you are interested in, and it's a way of networking as well, because remember, keep that practicum in mind. I think it would be cool to reach out or talk to someone you know to see if, hey, do you know someone in an organization that will be willing for me to just literally job shadow? You know, not to interfere, of course, if there's like patient care that you know you can't participate in, but anything that's within what your area of public health that you're interested in, see if you can job shadow them. And then that also too can go with what Amanda is saying with volunteerism, because sometimes people might need volunteers and they really don't know that they need them, and so they can work with their organization to get a volunteerism set up. But if you don't see you know, if you don't see the opportunity there as far as volunteers, internship, like Jeff said, don't be afraid to create it.
Yeah, and I just want to say, well, first, I do, honestly, I do think that having a year or two after undergrad, just to like, aside from the work experience that's required, just getting some like experience outside of academia and school is so beneficial to bring to a grad program. And that's like, I used to think, oh, they put these requirements of work experience just to make it more difficult for entry, but it's really because the lived experiences of the rest of your cohort members really adds to the discussion. And everyone's a different perspective on like how to approach a public health problem. So I think it'd be great for you if you could, you know, get some experience in after graduating with your bachelor's. But to that point, almost any job can be spun as a public health sort of perspective. So like I was working in a gym before, and you know, my friend was like, you know, you actually help people get physically fit and stuff like that. I was like, oh, I never really thought about that way. So, you know, it just really depends. Even just a basic, like I used to work retail, and like the interpersonal skills and dialoguing that I gained from that is super important for health communication. So it just really comes down to how you spin it and what you take away from that.
If anything, I was going to add that what Jeff said. I think, you know, when I talk to people and they're like, what kind of job should I look for? I'm like, whatever job you can get, honestly, because it is tough out there. And if you aren't able to find a job in the specific area, if you already know what you want to do and you just can't get that job yet, get something, because like what Jeff just mentioned, you'll make something out of it and you'll learn regardless. So I think, you know, it sucks to say, and you know, we hate to tell people, oh, work for free or like whatever, but it's just kind of the way that it is, and those experiences will definitely make you not only a better candidate, but also prepare you in the long run to succeed more or to do better in grad school. We did get a couple more questions. One, Chantel asked, what resources did you look into to pay for grad school? You know, for the panelists, feel free to share what you'd like. I can say that, you know, the UW School of Public Health has different ways that you can fund your program. I will point out that there is a unique difference between a couple of these programs. So for example, our Health Services MPH on-campus program is a tuition-based program, meaning you pay tuition based on your residency if you're in-state or out-of-state student. And you can utilize things like RAs or TAs, which you can also in the other programs, but they can act as tuition waivers. You can also, if you're employee like of the UW or a state employee, you may take advantage of the tuition waiver, things like that work specifically for tuition-based programs. Whereas our other two programs here, COPHP and online MPH, are actually what's known as fee-based programs, meaning we charge a specific fee per credit, and they're different for each program. So the pricing is a little different. And you may look at it and you may think, oh, in-state tuition is more affordable than these fee-based programs. I think one thing to consider is, you know, especially for the online MPH program, we charge the same for everyone regardless of your residency. And you still like pay as you go. You're only paying for the credits that you're taking that quarter. And another thing to consider is the sort of implications of, if you are on specifically for the online MPH program, where most of our students are largely self-funding their programs, because so many of them are working full-time. But of course, for all of these programs, there are scholarship opportunities and financial aid. It just depends on each student. But feel free, panelists, to chime in on your own experiences.
Okay, I'm just going to jump in here because if you ask me what I don't like about the program, this will be at the top. And I'm not afraid to tell you what I don't like about the program. I think that's a really important question to ask. Like, what don't you like about your program? So this was a really, really hard struggle for me. I did look at a couple of different schools, and one offered a scholarship and others didn't. Like Wade had mentioned, COPHP, and I didn't know this, Dolores, but I guess you are in the same boat. Our programs are what is known as fee-based programs. I had never heard of this before. I was like, what the hell is this? Long story short, it's just a different structure, and the money that you pay just goes to keep the program going, and obviously to pay like the instructors and stuff. But the downside of my program is that it doesn't get any state or federal funding, which really sucks. I won't lie to you. I was like, oh, like, how am I going to pay for this? So to answer your question, Chantel, the way I'm literally living off of student loans. But it's like I said, I had made a conscious decision to do something different in my career, and I had saved up some money from my previous job. So, I'm not saying everyone's situation will be the same, but for me, I made a conscious decision to take out student loans and do this program. And if you ask me, am I sorry that I did? No, because I am so grateful I chose this program. The fee-based thing sucks. I won't lie to you. There's tons of scholarships out there. I will say this. This is something that many other MPHers have told me. If you have the option of one school that's going to offer you a scholarship and another school that isn't, I do encourage a scholarship. You really shouldn't go into massive debt for your degree. You really, really shouldn't. I mean, obviously other factors go into it, but money is a really huge deal. Like, you really don't want to be in massive debt. And I'll be very honest with you, you shouldn't go into public health expecting to make a lot of money. I think this is not a money-making degree. So that's just something to be conscious about, but I will say the biggest downside of my program is the fact that it's not privy to state and federal funding. So I'm going into debt to get my degree.
No, Jeff, that's real, and I appreciate you sharing that, because it's really important for people to really understand everyone's journey. For myself, it's three things. I got a scholarship through my church that they offer every year, student loan, and occasionally, just out of pocket. I will say though, for scholarships, just even my experience with scholarships from both undergrads and now, I have definitely submitted a plethora of scholarship applications, and I can probably count on one hand how many I've truly been awarded. So I understand the thing about scholarships, but you just have to know that you're a competitor for sure with trying to obtain scholarships. And also too, UW School of Public Health sends out like newsletters, and they'll have internship fellowships, and they'll have scholarship offerings. And another thing too, if you're interested, I think you have to wait at least like a quarter or maybe a year in. I applied for so many TA positions because I didn't look at it as just like, TA covering tuition. Like, if I'm trying to get into academia, collegiate level, it is a great opportunity for learning purposes. However, unfortunately, like I said, scholarships, TAs, I've applied to 2 or more every quarter. And it wasn't until winter quarter, I actually got reached out to a professor that said, you were like our second round. When we teach this again, would you be interested? And of course, that is exciting. I'm getting ready to graduate. So unfortunately, it's like, with the opportunity that could have happened, timing just wasn't on my side. So definitely don't be discouraged, still apply, but just know that you need to have some backup plans. And I would totally agree with the student loan debt. However, know that with public, if you're in public service, public health, and you sign up for the program that the government offers for payment, 120 consecutive payments, which basically is 10 years, whatever is left is forgiven. So yes, that public service loan forgiveness, anything in public health, and it's like a little paragraph of what applies, definitely utilize that and keep that on the forefront. But if you're able to, pay even a little portion here and there on your own, and maybe, or, if student loans is what your option is to get your education, to propel yourself to the next level, invest in yourself, please. But just definitely try to do what you can do to supplement that, so it's not completely what you're relying on. Hopefully that helped.
Yeah, and then Wade, I don't know if you read this next one out loud. Probably not, because we all would have forgotten it by now. But it's so what advice would you give for applicants who may not have the strongest grades or GPA when applying for grad programs? And what could you do to boost your application? I would just say to know, one thing is we look at the last, or at least for health services MPH. I haven't given the webinars on the other ones yet, but yeah, we look at the last 90 quarter credits of your GPA, or the last, I think that's 60 semester credits. And you can retake certain classes to boost your GPA, just to show that you have quantitative readiness. But again, it's not all about GPA. It's not like a make or break thing. It's again, the word holistic is used a lot, and maybe the panelists can speak to that.
Okay, I'll go again. Okay, I'll be very honest with you. I failed out of college my first time going because I just really wasn't into it. And I got my shit together and I decided to reapply, and it ended up going to a pretty decent undergrad. But that's my way of saying that there's way too much emphasis placed on GPA. And like, I don't even think UW requires GRE scores anymore, but when I was applying, the GRE, like there was just so much. I remember how much I stressed myself out about my GPA and GRE and stuff like that. And you know what? This is why I think the lived experience is really important. I'm not kidding. I cannot emphasize this enough. When you come with a truly compelling story that really speaks to, you know what, like this is what I experienced. This is why I really, really want to go into public health. I kid you not, like those compelling stories can supersede a lot of these like numeric quantifications, are honestly arbitrary numeric quantifications, because you know what, I mean, and you'll learn this in public health, a lot of the standardized testing is embedded in very, very racist systems and stuff like that. It doesn't take into account how some people and some families don't have the ability to like engage in better test taking measures. So like, these are arbitrary numbers and scores. I'm telling you, that's why your lived experience that you bring to these papers, that these paragraphs that you be writing can really elevate you beyond those, I think, arbitrary numbers and stuff like that.
Yeah, this is true. I think there's a couple parts to this. So I think pretty much across the board for these programs, you know, the UW Graduate School overall does have a 3.0 GPA requirement, and it's really down to each individual program how much that matters to them. And for these programs, you know, if there are so many other great experiences, if you have, you know, specific reasons why that didn't work out for you or whatever, you know, we do look at all of that, and those lived experiences and professional experiences can ultimately be more important than your GPA, especially if you've been out of school for so long, you know, and you have all this relevant recent experience, you know, that at the end of the day is going to make you a better candidate than having, you know, a 4.0 GPA, but no experience. So there's a lot of different ways that we look at it. I will say that our program from the online MPH, I know that there have been many cases where students aren't quite there at the 3.0 GPA, and I think it's always really important to talk to staff to sort it out before applying, because there still is an expectation that you have some sort of academic success under your belt that can demonstrate that you will succeed in graduate school. And often, you know, your transcripts are going to be looking at that. And so the committee will see like, oh, they didn't really do that well in that course, but they did really well in this, and it all seems to balance out and it's fine. If your GPA is significantly lower than a 3.0, say it's like lower than a 2.8, 2.75, regardless of our committee's decision, it is going to be a little bit more difficult. It's going to be more difficult for us to successfully petition to accept you to the UW graduate school. And so even if we wanted to, the graduate school might ultimately be like, no, that's too low. And so I just want to be clear about that, which is unfortunate. But there are ways that you can either raise your GPA by taking a couple courses here and there, because like exactly what Lauren said, we count from most recent backwards. And you could either take courses that are going to, you know, prepare you for the program. For example, if you haven't taken statistics, we often tell people that's going to be really helpful going into the program if you have some experience with quantitative skills or reasoning. But you can also just take courses that will raise your GPA if that comes down to it. So take whatever you need in order to get that up. So I do think that's important, but not to fret if it's close to 3.0, but just not above the bar, as long as you know you are otherwise a good fit for the program through your lived experiences, through your professional experiences, the whole picture. So exactly what, you know, Lauren and Jeff said, but to keep those expectations, knowing that, you know, there's only, how low can you go? Not that low. At the end of the day, it's the UW graduate school has their sort of level of expectations. But I'd be happy to talk to you further, or, you know, you can get in contact with Lauren or whatever staff person for the program that you're interested in, discuss how to bolster your application. We touched on that. Oh, and just to be clear, for the personal statement, we've talked about how you can talk about your lived experiences and give the full story and like a compelling story and a reason why you're into that program. If there's anything that isn't evident on your any other application materials, that's where you can. So for example, if you suffered through a specific reason and that, you know, was detrimental to your GPA, that's kind of where you can explain you know, this and that, and that shouldn't count against you in the long run or whatever. That's your opportunity to give the admissions committee an even fuller picture of you as a candidate. I know we're getting close to time, but I know that there's been some chat. Thank you all for sharing your LinkedIns and your contact information. Yeah, any closing statements? We did get one more question. Where do you see yourself in the future? Where you hope to be professionally? We kind of touched on this, but to sort of close it out, do you all have any last things to say? Whether that's advice, whether that's your aspirations, what you're going for, what you know, what you are what you've learned, what you want to share.
I'll go. So I am going to stay here because I actually really love it here. It's just so beautiful here. You get over the rain after a year. Whatever I do, I have decided that I'm going to be an advocate for public health, accurate public health information. And I'm also, as a person of color and who is gay, you know, there's some really hard stuff going out in the world right now. And one thing that you will learn in public health is that your voice is extremely powerful. It's extremely powerful. And it's so easy to just kind of think, you know what, I'm not going to really say anything. But what I've taken away from this program is that my voice is actually has a lot of strength to it. And, I never thought it did, but that's something that you learn in your program. So I will be a public health advocate, an advocate for mental health, an advocate for accurate public health information. I'm going to speak for communities of color that don't really get to be heard. Here in Washington, Indigenous communities are very, very much entrenched in colonialism and racism. So whatever I do, I'm going to be a really loud public health professional. I'll tell you right now, I've definitely found my voice in this program. And I can proudly say I'm not really scared to share my thoughts, which is bad for you, but great for me. So.
Jeff, that was awesome.
It's a greater good.
I like it. I think that I mean, I've said what I wanted to do professionally, but I really find encouragement from what Jeff's two things. One, you said that you didn't really think of yourself as a leader, but you found that you are a leader, and then also your voice, and just that is the beauty of grad school too, because you're being exposed to so many different arenas and people and the rigors of academics. So just, stay the course, be open, learn and grow. But at least for myself, I really hope to truly, now that I'm in the state of Texas, where I'm not in Washington, where public health is adequately funded, and also the programs are just vast, and I have resources there with other nurses I've worked with and other medical professions and other public health and community professionals. I don't necessarily have that network here. But I also too am in a state that doesn't, how did the chief put it? Texas sensitivity is not Seattle sensitivity. So frankly, there are things that they legitimately don't care about. Some aspects of public health, this state does not care. Do they think it's probably important? Yeah, but is it going to be funded? No. They're going to give us the basic TB immunizations, HIV/AIDS, sexual health, like your bare minimum of what you have to offer within public health. Whereas Seattle and King County, there is a plethora of programs to help different communities. I don't think Texas will ever actually really say racism is a public health crisis. I don't think that's going to be on any website, no any billboard, no programs, no funding going towards it. So in piggybacking off of Jeff, I will definitely be that advocate for communities that are truly underserved. And, just being here, I too really see the importance. I need to learn Spanish. I need to be able to truly connect with my patients and not through an interpreter, or not have to go run and get another person to help me out. You really want to focus on who is your audience, because you can't do it all, but you can definitely make small bites. So find the program that's best for you, stick with it, power through it, ask questions, reach out. And I would just always say be encouraged and persevere, because this is your life. This is your life and you are pouring into you. So that's what I would say. And thank you again for this opportunity.
Yeah, and I'll close that real quick with the eye on the time. But echoing all that wonderful empowerment, I think that's what our programs teach us to do too, to be public health advocates and to walk with our communities and to work with people and be grounded in like principles of anti-racism and equity. And personally, also, Washington is great. King County is great. As a state, we lag behind a bit with mental health funding. We are like 40, I think it moved up a little, like 46 now as a whole. So that's what I personally want to work on, that systems change, and public health gives you the tools, the toolkit you need. And these programs give you the toolkit you need to go out and enact that change at the systems level. And so it touches so many people. And I'm a lifelong Washingtonian, so used to the rain, but I would like to give back to the communities that I'm a part of and be a part of working together to advocate and to catalyze that change together.
Excellent. Very, very nice to hear all of these encouraging words and words of wisdom, humble words of lifelong students, as I think Dolores mentioned. It has been truly such a pleasure speaking with you all tonight. I've really enjoyed this. I've been doing this event a couple times. Amanda did the last one with me, and it's been great. It's always different. We talk about the same things, but it's always just a different, and I've just really enjoyed this. It's been really great hearing from you all. Thank you to everyone attending live and for asking your questions. Yeah, I don't know if I can impart any other wisdom except for I was going to go back and share our contact information just for the end, that you can follow up with either Lauren or myself to, now that you've had a lot of great information from our current students. If you do want to apply to one of our programs, please get in touch with us and we can walk you through the process. We are the point persons, the main point of contact for these 3 programs that we've talked about, in addition to our MS and PhD programs. Lauren is the contact for those. So we hope to see you. We hope to talk to you again soon, and we hope to see you here in one of our programs if it is right for you. All right, y'all. Thank you so much. Again, been a great pleasure, and I hope you all have a wonderful evening. Good night, Dolores. I know it's a little bit later out there.
That's okay. I'm used to it now.
Yeah.
Thank you all. And Lauren and Wade, this was excellent. So thank you for putting this on. Thank you for so many listening ears. And Jeff and Amanda, it was such a pleasure meeting you guys. And hopefully I see you at graduation. So yeah.
Thank you for having me. It was great. And yeah, likewise, Dolores and Amanda, such a pleasure meeting you. And let's connect.
Yeah, we should.
Yeah, I already sent you a request on LinkedIn. So,
okay, we'll accept it. Okay.
Bye, everyone. Thanks.
Good night. Thank you.
Bye.
Bye.
Good night, everyone. Bye-bye.
Hi, everyone.
Good night.